Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide a COVID-19 update for the week ending December 3rd, 2020. As I've done in recent weeks, I'll talk about the growth and spread of the pandemic worldwide, the change in pattern in deaths in Europe and what that might mean for us in the United States, update on cases, hospitalizations, and deaths in the United States, and talk a little bit about the pandemic in our region. As we've seen over the past many months, the pandemic continues to grow globally, now passing another major milestone of 1.5 million total deaths and 65 million documented cases. As you know, we follow the week-to-week increase in total deaths because that tells us whether the pandemic is speeding up or slowing down. And this week, we've seen a 4.9% increase. This is a fairly significant number. And if you look at the past few weeks, you can see for a couple of months now, we've been running close to 5%. That's quite a serious number. At 4.9% week-to-week increase, we'd expect to reach 2 million deaths worldwide in about 6 weeks. That's a pretty serious growth rate. In terms of where the pandemic is, this pattern's changing a little bit. Remember early on, it was largely in Europe and then in South America. And now you can see Europe again is becoming the most heavily impacted place in the world. This is shown graphically from this information from WHO. Early in the pandemic, the deaths were in China. Then they moved into Europe, then into the Americas. But now look at this number of deaths in Europe. It's really quite concerning. So what can we learn from the change in pattern of death in Europe? What we saw, what we've been following was early on in March and April, almost all of the European countries saw a quick upsurge in the number of deaths. Then it leveled off. They saw very few additional deaths for 5 or 6 months. And we began to think that that might be the pattern for this pandemic. And then a couple of months ago, we saw this uptick here. This is showing for Belgium, but it was true for many of the European countries. This followed a upsurge in the number of cases, but fortunately, this second spike in deaths, which occurs now about 6 to 7 months after the first, appears to be going back down, and it didn't quite get to the level of daily deaths that we saw back in the spring. That may be because of better healthcare or other factors that we don't quite understand. But the important thing is that after months of being less than 1% week-to-week growth rate, it got up as high as 10%, now down to 4.9%, and appears to be coming back down. We are seeing this same pattern in all of the heavily impacted European countries, France, United Kingdom, Italy, and Spain. But we're not exactly sure what's behind it. We're not sure if it might be that it's a byproduct of opening up. People that were protected are now less protected. Whether it's a mutation or some new wave, is something definitely to keep an eye on for us in the States, because if that's going to be our pattern here, we need to anticipate it. In terms of the U.S., as always, I like to talk about the sequence of cases, followed by hospitalizations, followed by deaths. The number of cases, this is where all the cases had been in the U.S. as of August 13th. And then this is where the cases have been in the last 2 weeks. We're seeing a nationwide spread of this pandemic. This is the time course that we created a while ago. It takes us from July to December. And you can see in July, the cases in the last 2 weeks have been largely in the Southeast. As we put the map into time motion, not much going on really for a while. And then all of a sudden, we see this explosion in Alabama, and then North and South Dakota, Wisconsin, and then all of the upper Midwest, and then largely spreading throughout the entire country. This is seen graphically if we compare the end of July with the beginning of December. So we're seeing a nationwide explosion of this pandemic, including moving back into some areas that had been hit before. In terms of total cases, we saw a spike in the spring, another in the summer, and now a larger spike now. I'm not a big fan of cases because it's dependent on testing, but hospitalizations and deaths don't lie. And hospitalizations have been going up. Their week-to-week growth rate is 4% this week. Again, it's the highest it's been for the last several months. So that's a very worrisome trend. We see the same thing with deaths. Deaths have been going up fairly consistently, 269,000 deaths, a 4.3% increase in the past week. If we look at that more closely, that's the highest rate we've had since early August. So this is worrisome. We're seeing a spread geographically. We're seeing increases in hospitalizations, and we're seeing increases in deaths. This is quite concerning. At 4.3%, the number of deaths in the U.S. will hit 300,000 in about 3 weeks before Christmas. Earlier, we were projecting about 260,000 for the whole year. So as this rate goes up, the speed at which we'll hit 300,000, the speed at which we'll double, will also increase. We may be beginning to see an upsurge like we saw in the European countries in the most heavily impacted states, New York, Connecticut, perhaps, but it's not really clear that we're seeing that same pattern yet. Really, the way to think about this is a pandemic that is hitting our entire country right now, and not one that's as isolated as it has been geographically. In terms of our region, for those of you who've been following these video updates for a while, you'll remember that Virginia had many more deaths than Tennessee. Tennessee has now passed Virginia, and our region has 750 deaths. Virginia has been slowly coming down, though it tends to jump up and down a little bit, but 2.8% growth rate in the last week. If you look at where the cases are, again, largely here in Southwest Virginia. Tennessee had a much higher week-to-week growth rate. This 5.5% is actually the second lowest rate we've ever had. And I really hope it means that pandemic is slowing down, but it is occurring everywhere in our state. In terms of hospitalizations, again, a lower rate than we've had for several months. So hopefully we're finally turning a corner in our state, but it's too early to say definitively. If you look at our region, Northeast Tennessee, Southwest Virginia, Ballot Health catchment area, again, the same sort of pattern in total growths. We are not as low in week-to-week growth rate as we've seen in the other parts of the state. And at a 9% week-to-week growth rate, the total number of deaths in our region will double by the third week of January. Bottom line is globally, COVID-19 is still spreading widely. The number of deaths worldwide will likely double in about 15 weeks. But because the growth rate appears to be going up, that doubling rate could happen sooner. The European countries are once again the most heavily impacted, with 5 of the top 10 countries being in Europe. The U.S. is 7th in the world for total deaths, accounting for about 1/5 of all the deaths and about 1/5 of all the cases, but with cases occurring virtually everywhere in the country. The significant increase in deaths in the European countries appears to be slowing down. We really hope that's the case, and we'll keep an eye on it. We're not yet seeing a comparable resurgence, particularly in the most heavily impacted states, but with the growth rate in cases, hospitalizations, and deaths going up, we really have to keep an eye on that pattern. Our region continues to be one of the most heavily impacted. There's been a lot of news about vaccines. A vaccine has been approved in the United Kingdom. Apparently, a vaccine is being used in Russia and China. I would remind you that the vaccine has not yet been approved in the United States. And even once it's approved, it will be several months at least before everyone who wants to get vaccinated can be. So until then, we have to continue doing the things that we know work. Avoid unnecessary crowds, especially indoor crowds. Wear masks. Maximize the distance you are from other people and minimize the time you're close to them. Implement good hygiene. Cough into your your elbow, wash your hands, and so on. Stay home if you're sick. This is really important. If people who are infected are not exposing other people, we will interrupt this transmission. We need to do much more testing and contact tracing. We need to be more aggressive about quarantine and isolation, and we need to protect the elderly. And we need to have some compassion for each other. This is a difficult and trying time for everyone. Instead of arguing and fighting about the pandemic, let the facts guide our actions. And let's try to do things that we can to help each other instead of being critical and attacking each other. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. I'd really like to thank Melissa White for updating these slides and Dara Young for editing, producing, and posting this video. As always, if you have any questions, please feel free to contact me. I apologize to those of you who contacted me over the last week. I've been traveling and not been able to respond to everyone's questions. But if you have any questions, comments, criticisms, please let me know. I look forward to hearing from you. Thank you very much.